So this was the promise, that people will be able to decide what makes a difference to their recovery, make decisions about their public social care and health care and who provides it. So during the piloting, we had some really great examples of people being given budgets to spend on services and actually choosing to spend them on things that really made a difference. And they weren't services, they were things like driving lessons, holidays. One really often cited example is a guy, and this is a local example, is a guy who spent his budget on a woodworking lathe. And as a consequence of buying that lathe, he was able to start making wooden stuff. Because he'd made this stuff, he'd started taking it to a local market. Because he took it to a local market, he made new contacts, and because he did all that, he ended up getting a job. So if he'd have spent that on a service, none of that probably would have happened. So the promise was freedom to be creative, freedom for people to, a belief that people know what's going to make a difference. So that's the promise. And it was certainly the case during the piloting that those things happened. The reality is really different. As I've sort of explained, that yeah, there's not a lot of choice because people are being encouraged to buy services. So if you're a case manager and you've got somebody with a budget that you hold on their behalf, and you know, just to give you a sort of very simple description, the day service that they always used to go to is now closed because there's no contract for that service anymore. You're going to think, oh, I need to find them some other way of getting a day service. So you'd encourage them to buy a service from a provider that sort of looks like a day service. Because you just want, you know, as a case manager, you just want to sort of make sure that there's some care. But if that person was truly empowered to make a choice, they may well choose not to buy care. And that's the real challenge for providers, is to be relevant when people really do have choice. There's prejudice, notional budgets. It's also not very transparent. People often don't know they're eligible, and they are waiting to be assessed rather than demanding to be assessed. And this was certainly the case in the health budget piloting that's going on at the moment. Most people didn't know they were entitled to a health budget even within the pilot. So, you know, people need to know what their rights are. They need to know how to demand the assessment. They need to know how to push for their entitlement. Generally, providers are lifting their game. They're being a little bit more creative, a little bit more flexible, but way less collaboration. And this is, Jen and I were talking about this earlier, that you know, I've been in my job there 12 years, and you know, I've spent a lifetime sitting around talking about strategy with other organisations. Nowadays, no one says anything.
Including it.
Yeah, that's right. It's all intellectual property. It's all secret. So something's happening to the sector that is really negative. And certainly the clients who purchase services from us directly have a lot more power and influence over us than people that get services on a contract. Much as we want to involve everybody and enable influence, if someone is a customer and they're paying and they're determining the length of the contract, you have to provide an excellent service. And not just excellent service, but great customer service. You have to surprise people. You have to exceed their expectations, or they'll just go somewhere else.